If you're a therapist who clicked on this video, it's likely because you want to be a better therapist. You know that there might be gaps in your knowledge, that you were trained from a Western and individualistic lens, and you want to do better by your BIPOC and culturally diverse clients. You are not alone in this, and I am here to help you. When I'm hired to consult with clinicians, one of the most common questions I get is, should I address the differences or similarities in my identities with my clients? And if so, how do I even do that? The short answer is yes, absolutely. The long answer is what this video is going to be about. Hi everyone, I'm Sahej Korkoli, a practicing therapist who specializes in working with bicultural and multicultural clients, specifically first and second gen immigrants. I'm also author of the book, But What Will People Say? I'm a speaker, I'm a consultant, I'm a trainer in the mental health space, an educator. I'm also the creator and founder of the Bicultural Brief, a new newsletter on Substack that is a professional digest to help clinicians center cultural humility in their care. Today, we're going to talk about what I think is one of the most important and most underused skill in therapy, broaching. We will cover what broaching is, what it isn't, why it matters, how to broach when you have different identities, how to broach when you have similar identities, and I'll also share tangible skills that you can take away as a therapist into your practice today. So what is broaching? Broaching is a multicultural counseling skill, and it's about naming what's already in the room. It's when a clinician invites and acknowledges the client and their own power differentials, race, identities, marginalization, and privilege, to name it, center it, and to bring it into the work where applicable. What I often see what happens, and what I often hear from the community, is that a lot of therapists stay silent. They wait for the client to bring it up. If it's important, the client will name it, or I don't want to say the wrong thing. And I understand these fears, but they're actually holding you back from centering cultural humility and going deeper with your clients. Because quite honestly, I hear from the community all the time that they feel like they're not allowed to talk about their identities, especially if they're different from the clinician they work with. They're worried about saying the wrong thing, making their clinician feel uncomfortable. And that's a part of the work. That is why it's important for a clinician to broach and to allow the space for clients to feel like they can talk about it if it's something that they want to explore. In practice, broaching might simply sound like, I know we haven't talked much about your background yet. How might race or culture play a role in what we're discussing? Or even, I'm aware that we come from different backgrounds. If that ever feels relevant, I want you to know that I'm open to talking about that. Now, let me share what broaching is not, because this is just as important as knowing what broaching is. Broaching is not forcing identity into every moment of therapy. It's not assuming or stereotyping or tokenizing in any way. And it's definitely not making the client educate you. Instead, it's about making room for identity where it feels meaningful. And I want to be clear, when I say the term broaching, I'm not just talking about race or culture. I'm talking about any identity that your client might hold. This includes religion, socioeconomic status, immigration status, disability, caste, class, sexuality, gender, and any other intersection of identities that they might hold. Whenever I do workshops or consulting, I always have to remind clinicians that they also have to be very aware of their own intersection of identities, because part of the therapeutic process is the relationship between clinician and client. And so that means that the clinician should be aware of the identities they bring into the room and how that may or may not be affecting the client because of the intersection of identities they bring into the room. It's relational and it's contextual. Because the truth is, therapy is never culture free. Ever. It doesn't matter if the clinician is white, and it doesn't matter if the client is white, because every client brings every part of their background into the room, and that is rooted in culture. Every value, every norm about communication, about conflict, about boundaries, about speaking up, about mental health, about wellness, about relationships. All of these things are informed by our own individual understanding of culture and what is normal and what is normalized and what is valued. So when you broach as a clinician, you're actually making the invisible visible. You are naming what the client already understands as their experience, and you're saying, hey, I want to understand this too. I want you to bring this in. I want us to name it explicitly because this will help us go deeper in the work. It will not only help your clients feel safer sharing their stories and not having to worry about you not understanding or wanting to hear about it, but it'll also help you in attuning to their own experiences, the ways that they experience the world and are experienced by the world, which will only help the way that you treat them and conceptualize working with them. For example, guilt towards family parents might be a filial piety value at play rather than codependency. Or burnout might reflect the immigrant bargain and what children of immigrants have inherited when it comes to their survival mindset rather than just not having self care. Or silence in session might be cultural respect or intentionality or listening rather than resistance. It's important for us to think about how culture informs the way our clients show up, even when we're thinking about their symptoms and diagnoses and how we want to think about working with them and helping them. So, why does this matter? When we don't broach, clients often internalize this belief that parts of them are not welcome in the therapy space. And this is an experience a lot of BIPOC individuals feel in every space that they exist in. They might go to the workplace and feel like they can't bring their full self into the work. They might go into a friend group and feel like they have to leave parts of themselves behind. They might even go home to their families and feel like they have to cut off or truncate parts of their Western self because it's not welcome in those environments. And so we don't want therapy to be another part of the world so that they feel like they can't be their whole self in. We want it to be a space where they can take that armor off, where they can show up and actually explore every part of themselves without any shame or guilt. And as I mentioned, it's really important for clinicians because we don't want to pathologize culture or misunderstand their experiences or language choice. We want to be able to think with curiosity, with openness, and ask, well, what does this mean to you? When you use the word too tired, what does that actually look like? When you say things like depression, how does that show up for you? When you say you're close to your family, what does that actually mean to you? What does it mean to be close to your family? Where were you taught this definition of closeness? This is how we can practice broaching without it feeling like we're stereotyping, tokenizing, or having our clients have to educate us. There's helpful research by Dr. Norma Vines that I want to talk very briefly about, but you can find her research if you just Google it. She talks about the spectrum of broaching and the 5 areas that a lot of clinicians can land on. I personally love this framework because it encourages the idea that broaching isn't a single moment or there isn't a single right way to broach. Instead, it's on a spectrum, and we want to think about where we fall on that spectrum and how we can evolve the ways that we continuously broach in our work as clinicians. So, on the avoidant end of the spectrum, therapists will deny race or culture or identity factors. They will simply be colorblind in some ways and treat every client exactly the same, regardless of the identities that they hold. And then after avoidant, we have the isolating style of broaching. This acknowledges that culture exists and race exists and identity exists, but it kind of keeps it out of the therapeutic work. So maybe you're a clinician who gathers demographic information, but then you never really discuss it again and how it informs the client's experience. Then we have the continuing or incongruent style of broaching. And this is when a therapist recognizes that culture and race and identity are important, but struggles to integrate it into therapeutic work. So it's not that they're avoiding it per se, they struggle to actually integrate it into the work. So a clinician who might have a more incongruent style might be curious about identity from their client, but they also might feel intense anxiety, keeping them from really being able to dive into that work with the client. Then we have the integrated and congruent style of broaching. And this is a little bit better. There's a greater competence and cultural humility in the room, which is something that is really great. These therapists actively are considering how identity and culture inform the client's worldview and their experiences. Then we have the final level of broaching, which is the infusing style. This represents the highest level of broaching according to Dr. Norma Vines. This is where multicultural awareness is fully embedded in your work, in every part of your work. The way you interact with your clients, the way you view your practice, the way you supervise, the way you communicate, the way you show up in the world. This is the gold standard of broaching that I think every clinician should aim for and work towards. So multicultural competency and curiosity and humility around culture and identity is integrated from the beginning when you're doing intake and consultation to the end when you're terminating. And all throughout when you're thinking about diagnoses, when you're thinking about symptoms, when you're thinking about case conceptualization, when you're talking about your clients and seeking supervision, cultural competency is kind of embedded in all parts of your work. So it doesn't just guide the way that you think about your clients, it actually guides the way that you work as a therapist. So there's a difference there. We start with being kind of colorblind towards race and culture and identity. Then we work towards like understanding it's important, but feeling anxious about it. Then we work towards understanding it's important and starting to be more curious and have a greater understanding of its importance in the work. Then we have embodying cultural competency, cultural humility in every aspect of our work as a clinician. Now that I've shared a little bit about what broaching is, what it's not, the specific styles of broaching that research suggests, I want to talk a little bit about the different dynamics that could be at play. There will be three dynamics I want to talk about: white therapists who are working with marginalized clients or clients of color, clinicians of color who are working with white clients, and then when client and clinician share an identity or identities. All three of these dynamics require broaching, but the broaching might look different. So, if you're a white therapist working with clients of color or marginalized clients, it's very important that you consider how you broach and when you broach, because rapport is going to be very important. I've heard stories from clients of color who say, I literally walked into a room and my white therapist was like, "Oh, so you're Indian. Tell me more about being Indian." It was kind of a shock to feel like you don't know me, you don't know anything about me, and now you are only talking about this one aspect of my life or my identity. So instead, we want to build rapport. We want to slowly start to understand and ask questions and show curiosity. You would never go up to someone on the street that you're trying to say hi to and say, "Hey, you're a Black person," right? You would ask them questions, ask about their day, get to know them, build a relationship. And you want to do that same thing with your client before you start to broach and integrate that work. It should still be top of mind, but it's not something that you start with necessarily. A lot of white therapists tell me, I feel weird. I don't want to make it weird. I don't want to make my client uncomfortable. I'm scared of saying the wrong thing. And again, I want to remind you, it's not about being perfect, right? If you are aware and you have good intentions, you can continue to build skills to be able to broach and also repair and have these conversations so they don't feel so uncomfortable. And if you're a clinician who says, I treat everyone the same, you are actually just saying, I don't care that they have differences or that their worldview is informed in different ways. I am doing the work based on what I think is right, what my identities have told me and how I view the world. And that is also a part of the problem. So again, broaching isn't about naming difference to distance your client. It's about naming difference in order to build closeness. And that's why it's a skill. You might say in your first session, somewhere in there, I want to understand more. I want to make sure I'm not overlooking race or culture in our work. Is it okay if we start talking about that? Are you comfortable talking about that? Is that something that you feel informs your experiences or why you're here in therapy today? Or you might say something in your first session like, sometimes our background shapes the way we view our struggles. Is there anything about your identity or background that might be important for me to know so that I can understand how it informs our work together or what you're here to talk about? Clients of color and marginalized clients don't need you to have all the answers. That's white savior complex. What they really need is for you to listen, to be willing to talk about it, and to make space and recognize that their identities are important. The invitation should be to lean in, not to lean away, especially if you're uncomfortable. That means you need supervision and that you should be doing that work outside of therapy on yourself. It is not up to the client to make you feel more comfortable. If you're a white clinician, let me sum up some of the tips I have. Educate yourself, right? Don't expect the client to educate you. Don't outsource your learning to clients. You can read literature on oppression and racial trauma and privilege, and you can also seek out training. I offer a lot of trainings. Avoid color blindness, right? Don't treat every client exactly the same. It's okay if you approach depression or anxiety or certain symptoms with similar interventions, but you also have to think about how identity and culture is informing your client's understanding of their struggles and how that might be able to change the way that you work with them. And three, open the door early, but don't make it the first thing you say because you want to build relationship and rapport. But in your first session or even in the consultation, you can name that you want to integrate and center background and identity into your work, that it's important that you do that, and ask them, is there anything about their background or identity that you should know about them that could be important to the work that they want to do with you? All right, so the second dynamic I want to talk about is therapists of color working with white clients, because this is also something I hear a lot about and get a lot of questions from clinicians about. I hear a lot of therapists of color say, I'm worried about putting myself in a position of harm because of my client's bias, or I'm worried about centering myself when maybe our work has nothing to do with that. And that's totally fair. I work with clients who are white. I work with clients of all different backgrounds and intersectional identities. And I understand that sometimes it can feel like I don't want to center my marginalization or this dynamic when maybe we're not talking about that. But there are also ways to broach, right? Identity development is something that everyone has to do. It doesn't matter what their race or cultural background is. I see a lot of therapists of color maybe overcorrect. They don't want to be seen as too political, or they don't want their clients to stop trusting them in some way. And so I see them be more neutral to keep their clients comfortable. And honestly, I believe personally that that's doing a disservice to the relationship that you're building with this client. Broaching here isn't about educating your client, right, on your identity or the ways that you show up and experience the world. Instead, it's about safeguarding the relationship so that you can show up fully while also kind of bringing the macro into the micro, because therapy and the therapy relationship is a microcosm of how the client shows up out in the world. So you might say something like, sometimes cultural or racial differences impact the way my clients show up. Would you be open to reflecting that if it ever comes up? I want to make sure that we can also discuss differences that we might have between us that might inform our work. Does anything come to mind for you? It's about modeling cultural self-awareness. It's about modeling cultural competency and saying, hey, culture, identity, background, it shapes literally everyone. So I want to make sure it's a part of our work. What does that mean to you? How does that feel to you? Is there anything that comes up for you? When therapists of color protect their white clients' feelings or comfort over their own authenticity or even being able to show up as who they are, we can unintentionally reenact the same power dynamics therapy is meant to disrupt. If you are a clinician of color and you're working with white clients and you don't know how to broach race, let me sum up some of my tips to you. Prioritize rapport, right? Again, this is going to be the same advice I give every clinician, regardless of your identity and your client's identity. Notice and name the discomfort. I'm sensing some awkwardness on your end talking about this with me. Does it feel weird to be sharing this experience you had with another woman of color? That's something I've actually said to a client, and we had to talk about then. Yes, it was uncomfortable for them. And we talked about what that meant and how that brought up things about their identity and guilt and fragility and all of these things. Obviously, it was ongoing work, but it was a really powerful moment to bring that in and say, you're talking about an experience that you had with a woman of color, and you're telling me, your therapist who's a woman of color, this experience, I wonder, does that bring up anything for you? And I think it's also important for therapists of color, like any therapist, to also have their supervision and their training and their mentors who they can turn to when they are navigating some of these dynamics, because it's important for therapists to feel safe in the therapeutic process as well. I would never suggest that a therapist put themselves in harm's way with a client who might have certain biases, discriminations, or perpetuate racism and discrimination onto the therapist, right? That's going to require supervision and really thinking about whether or not that's going to be a fit long term. And then the third dynamic I want to make sure I talk about is when the therapist and the client actually share an identity. It can be tempting to skip the conversation altogether when you share the same identity as your client. I know that I have worked with clients who have the same religious, cultural, ethnic, heritage identity as I do, and they sought me out because of that. But I also had to be really mindful that I didn't just overlook their relationship with these identities or how it informs their experiences. And also, I wanted to be mindful that I didn't make assumptions on their experience because we shared the same identities. And it goes both ways. I didn't want the client to assume I would just get it because our experiences are going to be different. And I didn't want to think I would just get it because I share the same identities. So, it's something that I bring into the room, again, regardless of background. But I might say something like, we share the same background. I noticed based on, the paperwork you did that we share the same background. What's it going to be like for you to work with someone who is also X, Y, and Z? Some people might say, oh, I love it, that's why I sought you out. Some people might say, well, I'm a little nervous. Okay, how so? And then that will kind of bring out some of the dynamics at play with their relationships, with their identities, with their community, with their family, etc. Or I might even just name, we both identify as Indian American women. And I just want to be really mindful and honest here in the beginning that I might ask you questions that you might think I should know the answer to, but I never want to assume that your experience is the same as mine, or that you are that I understand what you're going through without you actually naming it to me. So I just want to share that now because I might ask you questions and that's going to be the reason why. Is that okay with you? Does that make sense? Do you have any questions about that? So I don't want to assume sameness. I don't want other clinicians who share an identity to also assume sameness, whether that's because you and your client went to the same college, you have the same hometown, you have a friend, a third party friend in common, you both practice the same religion, you're both parents, whatever it is. You don't want to assume that you understand their experience directly. Of course, you might have more inside knowledge, but you don't want to assume their experience experience because of that sameness. So I want to share a few guiding principles that I always teach when I work with clinicians and what I always implement in my own work. First, I will always lead with humility. I may not fully understand, but I'm going to do my best. That's just a way for me to say, hey, I'm here to learn too, and I'm not going to put the onus on you. I'm going to do my work, but I also may not always get it right. And that's just a part of the process. Second, I always invite, I don't impose. I don't say, well, culture must be impacting your experience, or you must have experienced racism because you're a Black person. Instead, I'll say, how do you think culture and race play a role in this experience you're sharing with me? Third, always repair if you misstep. Again, we're not looking for perfection, we're looking for attunement. You will misstep. That is part of the growth, but you can't have that keep you from broaching generally. So you want to be really mindful about how you might have caused a rupture. Hey, last week, I've been reflecting a lot on last week, and I realized when we started talking about your family traditions, you got a little quiet after I made a certain comment. I would like to just check in, maybe, and see if anything came up for you. And it's okay if not, but I wanted to just make sure that we talked about it because it's something that I noticed, right? That's how we can repair. You can also practice specificity rather than just generally asking about culture or religion or identity. Instead of saying, like, well, what's your culture like? You might say, oh, when you mentioned your parents' expectations, how can you connect that to your background? Where do you think that comes from for them? That'll open the doors without you having to generally just say, tell me about identity. Then there are a few things that I do regardless of a client's background. I always, always, always discuss race and culture and identity in the first session, regardless of my client's background. I always say that it's important to me to think about background and to integrate background into my work with my clients. Is there anything about your background that could be important for me to understand or for me to know about you so that we can make sure that it's something that I integrate into our work together? Second, I always use immediacy. I will always try to pay attention in the moment when I think something about culture or religion or identity could be at play. This could be gender, this could be sexuality, this could be masculinity, it could be anything. I'm reminded of many instances where clients have brought something up and then I'm realizing that maybe they feel like they're supposed to show up a certain way because of an identity that they hold. So I'm always paying attention to those moments where maybe we can bring that work in because it's a part of who they are and how they see the world. And I always, always, always name what's happening in the world. Not every clinician will want to do this, but it is a form of broaching. I will always start sessions if maybe there is a big event, whether it's like New Year's Day, right? Like a big holiday, or September 11th, or if something is happening in global politics or world affairs. And I might say, hey, there's been a lot going on in the world this week. I'm asking every client just at the beginning of the session if there's anything that's been happening in the world or in your life outside of what we've been talking about that you might want to bring into the session today. And sometimes a client is like, oh yeah, the election. And another client might say, no, not really. Like, I know this happened, but I want to stay focused on whatever it is we're talking about. And that's fine. I don't tell them we have to talk about it. I just open the door and I say, hey, do you want to walk through this or not? We don't have to. It's up to you, right? I give them the power to make that decision, but I always have the door kind of open for them. I always ask my clients if there are any resources I could read or watch or listen to that would help me understand their experience. Now, this can be a form of broaching in a lot of different ways. I have clients who hold sexual identities that I don't hold. So sometimes when we are talking about that and that's centered in our work, I might ask, is there a book that you've read, or is there a movie or a song or an article that you think could really help me understand your experience better? I've had Asian American clients tell me to watch certain movies and say, oh, that really reminds me of my boyhood or my childhood experience. Or, hey, there's this article that I've been reading that really feels like it speaks to what we've been talking about with family. I will never say, oh, just tell me about it. I will always ask, would it be helpful for you if I watched it or I read it or I listened to the song? And oftentimes they're like, yeah, and we can talk about it. And it shows that I am willing to do that work. I always name that the client has the power in the relationship. There is always going to be a power differential that clients feel, and especially marginalized clients are more likely to feel sensitive to that power differential because they are used to kind of not having that power. And so I always try to make sure my clients know very often that they have the power in the room and the relationship. I always say things like, hey, I trust you to know what's best for you. You are the expert on your life. I'm here to guide and help and be a resource, but this is your life. And it helps them kind of build that sense of confidence and agency that they don't always have in their lives. I practice self disclosure where I think it's useful. I've had clients ask me if I've ever worked with clients who have their identities, or if I could relate to their identities, or if I'm willing to talk about certain things happening in the world in consultation. And I will practice self disclosure to the extent that I know it could help my client feel more comfortable or have more knowledge to make a choice of whether or not they want to work with me. Again, not something that every clinician would do, but I think it's important to my work and it's really informed my relationship and rapport with the clients I do have. With that said, if you are a clinician who has a client who does ask a lot of questions about you, what's your stance on this? How do you feel about this? Do you have this identity? Do you know someone who does? You could feel like they're like pressuring you. It doesn't feel good to you. I understand that, but I just want to offer one reframe, which is they might be testing whether or not you're a safe person to talk about this with. So just think about how that's actually informing the way they're showing up and whether or not they feel comfortable being vulnerable in the room with you. That's going to lead to you understanding whether you need to broach in some capacity. I know that broaching is hard. I know that it can feel really uncomfortable. It's asking you to replace comfort with humility. And that is not always a pleasant experience. But I promise you that if you do start practicing broaching, if you start learning skills to broach, you will have deeper relationships and be able to do deeper work with your clients. So that's my call to action for any therapist watching this. Please forward this to any of your friends, your colleagues, professionals in your life. Make broaching a habit. Make it a habit, not a destination. You don't just do it once, not a checkbox that you check off your list, but a habit that you integrate into every part of your work. Don't wait for your client to make you comfortable, and make sure that you are paying attention to what your identities are and how they're informing the way you view your clients and you view mental health and the work that you're doing. And if you are a client and you somehow watch this whole video, I want you to know that you deserve a therapist who is willing to integrate your identities into the work where it's important to you. I'm Sahej Kaur Kohli. Thanks so much for watching this. This was such a fun video to make, and really, it's so important to me. I love doing this work with clinicians, and if you are a clinician, please follow the Bicultural Brief, my professional digest to help turn your cultural awareness into culturally responsive care. And if this was helpful, please subscribe, please like this video, please share this video, and please stay tuned for more culturally responsive work and content. Thanks for watching.